COVID-19, a humanized intellectual lens. A world paused. Imagine waking up one morning to find the world quieter, airports still, streets emptied, schools closed. And that morning was early 2020, when humanity collectively realized that a virus, unseen and uninvited, had redrawn. COVID-19 was not just a medical event. It was a biological, psychological, social, and philosophical earthquake, shaking everything from our. COVID-19 emerged in late 2019, linked to a coronavirus strain, SARS-CoV-2. Its zoonotic origin, likely bats and possibly an intermediate host, reminded us of our fragile ecological interconnectedness. Viruses cross boundaries because ecosystems are deeply interwoven, and human disruption, deforestation, wet markets, globalization, created pathways for spillover. This origin story is more than science. It is a mirror to our ecological footprint. The science of the virus. Nature of SARS-CoV-2, an RNA virus with a spike protein capable of binding tightly to human ACE2 receptors, entering cells, and replicating. Symptom spectrum. From asymptomatic carriers to severe pneumonia, organ failure, and death. Variants. Alpha, Delta, Omicron. The virus learned to mutate, adapt, and spread more efficiently. Transmission. Droplets, aerosols, surfaces. Human breath itself became a threat. Reflective pause. The most intimate act, breathing, was redefined as risk. How did that alter trust between people? Global impact. The 4 dimensions. Health systems. Hospitals overflowed. Doctors became soldiers without armor. Masks and ventilators became as precious as oxygen itself. Economy. Supply chains broke. Jobs vanished. Billionaires grew richer while millions faced hunger. The paradox was brutal. The virus was equal opportunity in spread, but unequal in consequences. Social fabric. Distance became love. Grandparents saw grandchildren through windows. Funerals streamed online. Weddings postponed. The social body itself felt fractured. Mental health. Anxiety, depression, loneliness, fear, our inner landscapes darkened. The pandemic was not only viral but also psychological. Human stories. Faces behind the statistics. Every number had a name. Every curve had a story. A nurse sleeping in her car to protect her children. A migrant worker walking hundreds of miles to reach home. A teacher learning Zoom overnight. A child asking why hugs became dangerous. The pandemic was deeply human, reminding us that science without empathy is incomplete. The response. A global experiment. Lockdowns. Humanity tried collective stillness. For some, it was protection, for others, prison. Vaccines. mRNA technology leapt forward, offering hope. Never before had science moved so quickly. Misinformation. Alongside the pandemic ran an infodemic. Rumors, conspiracies, and denial spread faster than the virus itself. Community resilience. Neighbors delivered food, strangers donated plasma, artists performed online concerts. Ethical and philosophical questions. COVID-19 forced humanity to wrestle with uncomfortable truths. What is the balance between personal freedom and collective safety? Who deserves medical care when resources are scarce? Should economies or lives take priority? Did we fail the poor, the elderly, the vulnerable? These were not abstract questions. They shaped real policy, survival, and grief. Lessons learned. Preparedness matters. Healthcare systems need resilience, not just efficiency. Science saves, but trust sustains. Vaccines worked, but mistrust undermined progress. Inequality kills. Poverty, race, and geography determine survival rates as much as biology. Human connection is oxygen. Isolation proved that community is not luxury, but necessity. Interactive reflection. If you were writing history, imagine you are the historian of 2050. How would you narrate COVID-19? As a story of human fragility? As proof of scientific genius? As a warning about ecological imbalance? Or as a rehearsal for future global crises? Moving forward, beyond the virus, COVID-19 did not just end with vaccines. It seeded new realities. Remote work is now a global norm. Digital education expanded access but deepened divides. Public health awareness grew, but so did distrust in institutions. The philosophy of everyday life changed. We value hugs, air, and presence in new ways. Humanized truth. The virus may fade, but its imprint on our collective memory will not. It has become a chapter in the story of what it means to be human in the 21st century. A shared humanity. COVID-19 was not just a disease. It was a teacher, harsh, uninvited, but unforgettable. It taught us that our bodies are vulnerable, our systems fragile, our relationships precious, and our planet interconnected. In the end, the most important vaccine was not just biological. It was empathy, solidarity, and memory.